Everybody's getting the flu right now. Cases are surging across the country as fewer Americans are being vaccinated for it. According to the latest CDC data, fewer than 130 million Americans have received a flu shot so far during the 2025-26 flu season. That's down from a few years ago when more than 190 million doses were distributed during the height of the pandemic.
Doctors are seeing positive influenza tests left and right following the holidays with no signs of slowing down.
Right now, 1 in 3 people that test for the flu are positive. This is a really hard flu season. It's much worse than we've seen in recent years. Certainly not since 2009 have we seen a flu season that's this bad, and this may end up being worse than that season was as well.
And while it's not uncommon to see a rise in flu cases around this time of year, doctors say that this year's spike has come quicker and bigger than years prior, which is why with work and school starting back up and flu season continuing through March, what's already been a rough flu season could continue to get worse.
Traditionally, we see a peak a little bit later January, February, but we are seeing an earlier peak this year, and we are seeing more of the influenza A.
For a lot of people, the flu is no big deal, a couple of days of sniffles and a sore throat, but we're seeing it spread so fast, and we're seeing it really impact folks. And so, last year in the United States, there were nearly 300 children that died of the flu. I'm fearful that we'll exceed that.
This year, 30.9% of tests reported to the Department of Health were positive for flu, compared to a 28.9% rate this time in 2025. Similarly, 8.5% of emergency department visits were for flu, compared to a rate of 7.8% last year.
We are a hub of tourism, so visitors are coming in, and we're just and parents have to work 1 or 2 jobs. So again, I think it's just all a combination of factors that's increasing this.
If you haven't gotten a flu shot, go get one. It's relatively painless, and it can really potentially keep you from getting as sick. It can keep you out of the hospital, potentially keep you from dying.
Nathan Shinagawa, KHON2 News, working for Hawaii.
Louisiana continues to see an influx of flu cases even until the new year. Urgent care facilities are seeing their waiting rooms at capacity, while pharmacies are placing signs urging people to get flu shots. At Chateau Drugs, the pharmacy is all hands on decks to stay fully stocked as more and more flu prescriptions come in.
I've been here for almost 50 years, and this is the worst season I've seen yet. We're doing more flu vaccines now than we did at the beginning of the season, because now everybody that normally doesn't get vaccinated sees the need to get vaccinated.
The pharmacy says there's a high demand for the prescription drug Xofluza, used to treat the flu.
Take 1 tablet, and usually the next day you're feeling much better. It's available right now, but it goes in and out of availability right now because the demand for the flu cure is very high right now.
The New Orleans Health Department Director, Dr. Jennifer Avegno, says a rise in cases usually occurs when families gather for the holidays. This, combined with some not getting the flu shot early enough, result in a super spreader. With children and the elderly among the most vulnerable, Avegna urges people to get the flu shot immediately.
You can get pneumonias on top of it that can be fatal. You can have complications from that flu that last a very long time.
She says as of now, it's hard to say when cases will drop in Louisiana, especially as more events are set to start.
It's not too late to get your flu, your COVID, and your RSV if you qualify for that, because that's going to protect you for carnival season. So if you haven't gotten it, don't worry, you can still get it.
What we're seeing right now is a fairly severe influenza season.
The severeness is critical. The Illinois Department of Public Health confirms the state's first child has died from the flu this season. Officials did not disclose age, location, or vaccination status, but physicians like Dr. Larry Kosiolik of Lurie Children's Hospital are sounding urgent warnings as a deadly virus threatens communities.
The amount of infections that we're seeing now is at the peak of last season, and we anticipate when kids go back to school, that we're going to see additional cases.
When it comes to children, Dr. Kosiolek says the flu is hitting all ages, but kids under 5, especially those under 2, are at the highest risk. Flu activity in Illinois has soared to very high, the CDC's most severe level. In Cook County, emergency room visits for the flu have already surged.
At the beginning of December, we were seeing about 30 cases a week for a few weeks. Over the last 3 weeks, we've seen as many as 350 children a week at Lurie Children's.
This year's a little bit different because we've got this subclade K virus circulating.
Dr. Stockton Mayer of UI Health warns this new flu variant is triggering an earlier and more aggressive start to the flu season. The current vaccine does not perfectly match subclade K, but health officials still urge getting vaccinated, especially for high-risk groups such as children, those with immune or heart conditions, and other vulnerable populations.
Vaccines are super effective at helping clinical illness, right? And people from getting super sick from a lot of these respiratory viruses.
Hi there. Well, this is largely because of the holidays, and according to the Trump administration, they released a new report, and according to the data, this year the flu season, well, it's slated to be the worst. Now, they're looking at 45 states reporting these numbers and essentially saying we are headed for a pretty bad flu season when it comes to the peak of it for January and for February. Now, much of the spread is being driven by a strain known as H3N2 subclad K, which has quickly become the dominant flu virus in the country. Doctors say that subclad K is part of the influenza A H3N2 family, a group of viruses often linked together during flu season. While experts say this strain does not appear to cause more severe illness than the typical flu, it is spreading quite rapidly, sending tens of thousands of people to the hospital. According to the CDC, at least 4.6 million illnesses, nearly 50,000 hospitalizations, and about 1,900 deaths nationwide have been reported. Another concern, more than 90% of the H3N2 cases analyzed involve the newer strain, which is slightly different from the virus targeted by this year's flu vaccine.
I think we all should get shots. I mean, you know, it's preventative. When I was growing up, we had our, the shots for all these different diseases, and there was no problem. Polio. And so, it's an upside to get the shot, because the downside is when you get older, you can get sick.
I got my flu shot about 3 weeks ago. If I happen to come into contact with somebody who has the flu and they've given it to me, it won't take me down. It won't, beat me, give me the beat down as it might have had I not got that little extra protection.
That's right. That little extra protection certainly does go a long way. Also making sure that you're washing your hands and doing everything you can to stay safe during this flu season. I'm Lena Bourbon reporting here in Larchmont Village, KTLA 5 News.
As holiday travel comes to an end and schools open their doors again, flu cases are spiking in Kern County.
It's the second half of December we really started to see that increasing rate and test positivity.
Flu season is here, and it's come in swinging. Positive flu tests spiked 18% in Kern County during December, due in part to the rarer H3N2 variant, or super flu. Even for flu season, that's quite a jump. And that number is probably a huge understatement, since it counts only people diagnosed by healthcare professionals. It doesn't count people who just stayed home and suffered.
Is we're at the beginning of a big upswing in flu activity. It's a particularly rough strain this year, the H3N2 strain, which is not a common one that we get year to year. And so it's real important that people get their flu shots as soon as they can. If they are sick, it's definitely a good recommendation to come get seen right away, or if you have a virtual option, get that done.
Kern County's Chief of Family Medicine for Kaiser Permanente, Frank Lang, says the season's only begun. The true peak of positive tests and flu cases could be months from now.
Definitely on the upswing right now. The peak, to my eye, looks like it'll probably start to peak in early February compared to previous years. And so the next few weeks are going to be a bouncy one.
COVID and RSV cases have also been reported, but Dr. Lang says their rates remain low. He adds, if you're feeling flu symptoms, get checked right away.
The classic is things like fever, runny nose, sore throat, body aches is a real classic sign. If you're getting any of that now, especially in the next few weeks, pretty high chance that that's influenza.
Flu medications work best within 48 hours of symptoms, so don't wait. Jacob Clark, 17 News.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.